Hi, my name is Adam Malik, and this presentation is in regards to the Healthy Community Brookfield, in regards to the organization overview and strategic planning for HCB Board of Directors. In regards to the organization's history, HCB was formed as a freestanding, not-for-profit agency in 1998. A wealthy benefactor offered to donate $2 million in 1997 to expand the work of the organization with its own board of directors, hence the establishment of HCB in 1998. Prior to being HCB, the organization was formerly a Department of Local, County-sponsored Visiting Nurse Agency, or VNA, whose purpose was to manage two state contracts for intervention and prevention purposes of cardiovascular disease in populations and health promotion initiatives throughout schools in the county. In regards to the overview of HCB, HCB is a not-for-profit charitable organization dedicated to promoting public health and wellness of the Midwestern county of Brookfield. Brookfield has a population of 85,000, and the city of Dakin makes up 3/4 of the population. The remaining population is comprised of small rural communities. The majority of residents are blue-collar, including agricultural-related businesses, manufacturing companies, government county, city jobs, healthcare, or state jobs. Minimal public health infrastructures are located within Brookfield with limited resources, resulting in traditional public programs via contractual agreements by HCB. Medical services consist of a hospital, private physician practices, health clinics, visiting nurse agency or VNA, outpatient rehab clinics, and other community services and organizations include Meal on Wheels, YMCA, Elder Services, Regional Transportation Services, and the United Way. HCB has several programs and services associated with the organization. HCB has provided nutrition education for teens, babysitting courses, group bereavement classes, and caregiver support groups. Programs were initiated and discounted based on grant and county funding. Today, HCB provides health, medical services for women, employee health and wellness services, case management services for the elderly, violence prevention programs, smoking cessation classes, diabetes education classes, teen after-school programs, school health, wellness and fitness programs, well water testing and water problem mitigation assistance, and vaccine and immunization services. Today's programs are all contingent upon grant funding and county budget fund allocations, and currently, funding cycles for the diabetes education classes and well water testing and water mitigation assistance will end in just a few months. In terms of the mission, vision, and values of HCB, the vision statement for HCB is as follows: the promotion of healthy practice leads to improved health behaviors and healthier communities. The mission for HCB is to improve the community's health by strengthening the quality and performance of health promotion and wellness practices. In terms of the values, HCB values honesty and integrity in the services they deliver to the community, high quality services, connectedness with other community partners, staff and their well-being, and being a public health leader in the community. Several environmental factors affect HCB and their organization. For instance, in regards to community expectations and relationships, there is a lack of understanding as to what the organization actually does, including confusion about programs and services from community partners, key stakeholders, and even employees. In terms of economic forces, programs are contingent upon grant funding and county budgets, which can be unpredictable. Lastly, in terms of the political environment, members of the board of directors and senior management have different views as to the ultimate goal of HCB, including beliefs about seeking grant funding and whether or not it aligns with the mission and values of the organization. For the cultural assessment and employee engagement analysis of HCB, there are several major trends that can be identified throughout the analysis. HCB employees appeared to be moderately happy with the functions of the overall organization, including quality and productivity, leadership and management, and communication. However, several ratings suggest that HCB employees would like to see improvements associated with recognition and positive reinforcement for their efforts, stronger communication between the community and higher-ups, including directors and management, and alignments between missions and programs of the organization. HCB employees are proud to work for the organization, believing that there is effective leadership, a friendly and respectable environment, along with the opportunity for advancement. HCB welcomes disagreements to improve service delivery, and attempts are made to consider everyone's views before decision-making is completed. However, senior leaders are reportedly not visible in the organization, and plans are not communicated to the community at large. In terms of the financial sustainability analysis and concerns, programs are contingent upon grant funding and county budget fund allocations. Funding cycles will end for some programs soon, including the diabetes education classes and the well water testing and water mitigations assistance. HCB did not meet the local public health department's accreditation requirements, leaving future funding for some programs, including prenatal and newborn care, smoking cessation classes, and immunization services, vulnerable. Lastly, the main concern is that HCB's mission and vision of the organization are unclear, deterring key stakeholders and outside partners from providing funding to programs and services to the organization. There are several strengths and weaknesses associated with HCB. In terms of the strengths, HCB is viewed as a good place to work with cultural readiness to change. HCB values the staff and their well-being, connectedness with other community partners, and they value high-quality services. In terms of weaknesses, there's a lack of understanding as what the organization actually does, confusion about programs and services, as well as unpredictable funding. Employment is unstable with the perceived hierarchy in the organization. Law enforcement questions some of the strategies associated with the violence prevention program. Local hospitals are unclear as to the elder care follow-up program post-hospitalization. County officials are continuously frustrated by yearly demands by HCB for increased funding for the agency, and several others. In terms of the opportunities and threats associated with HCB, opportunities include the creation of a mission that is more narrow, allowing a clearer focus and vision of HCB that the community and staff can better understand. The creation of a better system of communication with employees to increase employee happiness, long-term welfare, and recognition or rewards upon program outcomes. Top leaders can better take control of interacting with employees, increasing respect and clear direction of communication between leaders and employees. In terms of the threats, there is unpredictability of program funding, lack of communication between top leaders and employees, lack of recognition and positive feedback based on program outcomes, and the value of doing things right the first time. In addition, there's a lack of resources dedicated to educational efforts regarding quality improvement and program efficiency. In terms of recommendations and actions, many of HCB's partners and constituents have a lack of understanding of when it comes to HCB's goals and mission. This lack of understanding can cause stagnation within the organization while preventing access to grants and proper fund allocations. By learning as much possible about the community, HCB can better understand the community's cultural, social networks, norms, values, and history. In addition, a broader goal may enable community leaders to involve larger segments of the community. Therefore, a narrower focus on specific goals will assist in keeping activities more directed and manageable. It is vital to address these issues through the implementation of the above referenced strategies, because understanding how the community perceives the benefits and costs of participating will facilitate decision-making and consensus building, which will translate into improved program planning, design, policy development, organization, and advocacy. The following next steps are recommended for HCB to take to improve quality and efficiency within the organization. The first step is an analysis or assessment, where an understanding of the current internal and external environments is developed. The second step is strategy formalization, where a high-level strategy is developed and a basic organization-level strategic plan is documented. The third step is strategy execution, where the high-level plan is translated into more operational planning and action items. And the last step is evaluation or sustainment/management phase, where ongoing reinforcement and evaluation of performance, cultural, communication, data reporting, and other strategic management issues occur and are discussed. In terms of launching the strategic planning process, the first step is communicating the plan to stakeholders, partners, and other people of interest. Second in the process is monitoring and evaluation. This is critical to plans for success and credibility, and it must be built into the plan and is critical for continuous improvement. And lastly is the continuous improvement phase, which focuses on improving customer satisfaction through continuous and incremental improvements to the process. In terms of funding, consistent grant funding and budgets will be needed to complete the strategic planning process at HCB. Creating an annual budget will help develop a realist fundraising goal and give a context to the funding decisions. And lastly, funding will assist in the goal set by HCB board members. There are still several questions that would need clarification for the planning process at HCB. The first are, what are some strategies that can be utilized to create a budget proposal for HCB's strategic planning process? In addition, what other forms of funding can be used to assist HCB in its goals and missions?